Ladies and gentlemen, this is Richard Fowler, and the Richard Fowler Show is presenting you Talking Together, a conversation about COVID-19 and people who are on the front lines, or everyday Americans dealing with how they handle COVID-19 in their daily lives. Joining us for the first conversation today are Rick and Lori Lucas. They're both healthcare professionals in Ohio on the front line fighting against COVID-19. Rick and Lori, thank you so much for joining me this morning.
Good morning.
Good morning. Thanks for having us.
So one of you guys are a registered nurse. The other, so Rick, you're a registered nurse. Lori, you're a respiratory therapist. But before we get into sort of what's happening today, I think I want to start with, when did you guys realize, when was the sort of, oh no, we're in trouble happen? Like, when was that moment?
Looking around and seeing what was happening around the world, definitely gave us a little pause. But then when we started to see it roll into the United States and hearing what was happening in the state of Washington, really gave rise to concern, because that showed that it was real, that it was here, and that it could definitely happen here.
He was much earlier than I was. I was still kind of like, oh, it's not going to come. It's not going to hit us this hard. And I don't know, maybe a week ago when New York started getting hit, I think that's when I kind of woke up and was like, okay, maybe it's here.
It's here. And I mean, I think that's the ominous part, right? So you guys are also, beyond the fact that you guys are healthcare professionals, you guys are also parents, which what makes this even more stressful. So just give me a sense of, like, what does a day in the life look like for the two of you as you guys sort of battle this this disease, this invisible enemy?
Yeah, we were taking it day by day, gauging our exposure at work, and trying to be thoughtful in what we were going to do with childcare. My parents babysit for us when we both work. So a couple of weeks ago, Lori had a worrisome encounter with a patient where she felt that she was exposed, and so that definitely heightened our concerns. So luckily that patient came back negative, so that definitely gave us a minute to take a breath and come up with a plan. So right now our children are staying with my parents for an indeterminate amount of time until we can really kind of figure out where things are going here in Ohio.
That's got to be hard, Lori. I mean, obviously for you too, Rick, but Lori, like a mom saying, I've got to leave my kids in order for their own safety.
Yeah, I think it's the best decision, just for the fact that we won't give it to them or have them take it up to Rick's family or, his parents. Try to stop the spread. So it's not easy, but I think it's the best decision we could come up with.
For sure. Now, Ohio is one of those states where when you hear people talk about COVID-19, you hear people talk about Seattle, Washington, you hear some conversations about California, you're definitely hearing conversations about New York City and New York, but Ohio is also a state that's being hit pretty hard by COVID-19. I mean, we've seen the governor come out and basically authorize a full-fledged shutdown of the state. Are you guys seeing those implications on your daily shifts? And both of you guys are night shift workers, if I'm not mistaken, right?
He's day shift, I'm night shift.
Listen, that's my mom was a registered nurse, and like I get it. So you balance the kids out. One person has it in the day, one person has it at night. It makes total sense.
Yeah.
So, one of the things that we definitely see with all of the changes here in Ohio, and especially ending elective procedures and appointments, we're seeing the census in the hospitals drop pretty significantly. So the census now in the Columbus hospitals is hanging around 60% in the 60% area instead of 85 to 90 or higher. So we're actually seeing some nurses being able to take some time off and kind of gather, take a breath right now in this time. So it's a little bit of an eerie time. It's definitely like that calm before the storm.
Yeah, it's definitely a calm right now, and it is eerie, very eerie. Empty hallways, empty, nurses stations. Just it's like we're waiting for the storm to hit, and we don't know when it's.
Do you think the storm is coming?
Yes.
And what do you think it's going to look like from your vantage point?
So what we've heard is that at the peak of this in Ohio, they're projecting 6,000 to 8,000 additional cases a day confirmed. So we're seeing consistently that as those numbers rise, the numbers on people hospitalized and the mortality rate stays pretty consistent. So it's going to be a very, very tough, challenging time. We're worried about having to ration care. We're seeing some states look at coming out with guidelines of who they're gonna provide care to and who they're gonna provide just comfort measures to. There was a discussion, I think, in the Chicago area about like a universal DNR,
Mm.
where if a patient would decline to the point where they would need resuscitated, that they would just be provided comfort care. So that's terrifying for us to see people in need that we might not be able to care for, and I think not having PPE
And just
readily.
for folks who are listening, because I mean, you hear the acronym PPE, everybody's saying it, you hear it on the news, the president's even saying it. What does PPE actually mean? And what is it exactly?
So PPE is personal protective equipment. So that's the gowns, the gloves, the masks, the face shield, all of those things that we wear to prevent infection. So they're kind of a last line of defense after you put in all the other controls to minimize the risk to workers. And so the fear of not having enough PPE to safely provide care, we're afraid for ourselves, but we're also afraid that we're going to spread this around to other patients because of the reuse. We're seeing reports out of New York where nurses are wearing trash bags.
Yeah, I've seen those. Now, Lori, the reason I'm so happy that you're joining us this morning when we're doing this, because people talk about ventilators all the time, and anybody who knows anything about hospital or what happens in a hospital, ventilators are also come with the people that work the ventilators, which are respiratory therapists like yourself, right? So it's beyond just you could have 30,000 ventilators, which you only have one respiratory therapist.
Yes,
You're sort of in a lurch there.
we
So
are.
how is it going for you? I mean, I think you are probably one of the most in-demand people right now, because you guys have to work these ventilators. So how has life been as a respiratory therapist encountering that? You hear people talk about nurses, and I love nurses. You hear people talk about doctors, but nobody's talking about the folks that are actually necessary to run these ventilators.
Um, so far, my hospital has not had a positive case come back yet. We've had a lot possibles, and we have had some possibles on vents. I don't know what to expect yet. I guess we're talking about running. My hospital can run up to maybe 40 vents at one time, which would be tons. On an average, we have maybe 5 to 6 vents a night running, so that would be a huge influx for us. And we're going to be. I think there's 30 therapists that work with me days and nights, so we will be running 12 hours. I think we'll be there all the time. So we're just trying to get prepared and be ready for whatever comes at us. So it's a little tense right now.
And let's talk about that. If we could dig into that tension for just a minute, because I think that's something that's so real. As you see more and more healthcare like frontline workers sort of not only testing positive for COVID-19, but beyond testing positive, who are also some losing their lives. We saw recently, just 24 hours ago or so from when we're doing this interview, a department head in New York lost their life and in the emergency room. I mean, you guys have kids, and I mean, one thing you know about nurses and respiratory therapists is that you show up no matter what. What's that feeling like, right? I mean, because it has to be a very, for some of us, we can sort of shelter in place and be in our homes and watch movies and Netflix and chill. But for you guys, the work has to continue.
I know the last week I've been a little sick on the days I've had to work. I've been nervous, sick, anxious. As soon as I get there, I'm fine. But going in, like they're taking your temperature as you walk in the door, and you don't know what's coming up. You know what to expect, and just sick to my stomach, and deep breaths
Mm.
as I'm walking in the door.
Rick?
I think one of the ways that we kind of cope with that is we worry so much about everyone else that we don't really have time to think about it. There's just so much going on right now, and trying to find a new normal, and every time we think we found it, there's another huge sweeping change or something else coming at us right now. So it's a very, very difficult time. It's very eerie walking into the hospital, especially in the daytime, and not seeing visitors, not seeing folks outside or congregating, and seeing the social distancing on the floors where chairs are purposely taken away from desks and separating folks. So it's definitely lots and lots of adjustments.
And I think that's the part that people don't actually realize is happening, right? And I'm so glad you brought that up, Rick, because not only are you guys engaging in just the fact that you have to go to work, but on top of treating people, you guys also have to socially distance yourselves, which makes life even like in a team effort. And I think especially when you work on some of these floors, it's a team activity. There's a lot of times where you'll have a respiratory therapist and a nurse in the room at the same time. There's times where you'll have the doctor and the nurse in the room at the same time. So how has, dealing with that made life more complicated?
My sister's a respiratory therapist in another town, and she usually does rehab, pulmonary rehab. And since they shut the rehab down, they pulled her back into respiratory therapy floor work. And that's what she asked me, because she really hasn't done it in a long time. She said, not only are we treating the patients, but then we're coming back to the department, because respiratory has its own department, usually a room, you're around a table, you're with, 5 or 6 other people. I said, and then we're all sitting there touching the same thing, doing the same. I mean, we can't constantly clean. We can clean in between, but, and the chances of one of us being, exposed are good. So, I mean, if one of us gets it, I think it's going to go through the department quickly, kind of like the flu does with us. The first person that gets sick, and it's just going to be down the hill from there. So it's hard to social distance for us, I think.
And that has to be, I mean, just being real, like that has to be scary, right? That has to be very, I mean, when you say you're going into work and you feel sick and anxious, like how could you not?
Yeah. Again, when this all started, one of the day shift girls and I were talking, and she said, Lori, she said, the chances of us not being exposed to this are crazy. I mean, we're all going to be exposed at some point, hopefully not bad. Hopefully we all make it home at the end of the day, but chances of us, I mean, they're rolling through he doesn't do ER work very much, but they're rolling through the ER and you don't know what's coming in. So you don't know, basic things. So before we can put on our gear or anything, we're seeing them, and it's nerve-wracking sometimes.
Mm. And Rick, you work like Lori just said, you work in the ER, and I think the ER is sort of ground zero for fighting and taking on this invisible enemy of COVID-19. What are your feelings going into a shift, working 12 hours, knowing that there's a possibility at the end of this shift, I could come in contact with this invisible enemy, and I have to go home. I have to go home to Lori. I have to go home to my kids. I mean,
so I'm on the response team for the hospital. So we kind of go all over and care for folks when they're declining. So I have encountered patients that have COVID-19, and part of the the efforts on the floors to intubate them and put them on the ventilator, which is one of the high risk times when you're caring for these patients. And so, I'm very diligent about wearing the correct PPE, and luckily right now we still have that available. It's really uncomfortable though, because we're reusing masks. We're reusing masks patient to patient. We're told to put them in a paper sack, and then when we leave the room, and then whenever we take it out and put it back on again. Nurses were even sent a page that said, at the end of your shift, put your brown paper sack with your mask in your locker. Mm. And if you come back in the next day and there's masks available, to throw that mask away and get a clean one, which really creates a sense of urgency that, you know, the mask that you got today may be the last mask that you're going to get.
Wow. That's wow. And what should folks at home, folks, I mean, there's a lot of folks who have so many questions, not only about COVID-19, about what to encounter at the hospital. There are folks who, and what we've heard from a lot of folks, I don't know if you're seeing the same thing, Rick, is that people who would normally go to the hospital for a broken arm or for like, they might be short of breath. They might be short of breath and they don't have COVID-19 because they have they have a, you know, a long-term lung disorder. And they're like, I'd rather not go to the hospital. I'd rather not get care. I'd rather stay at home. Are you starting to see that in your emergency room?
We're seeing a rapid decline in the number of patients that are coming in for care. The people that are coming in definitely need the care that they're there to receive. But there's quite a few folks, you know, with our healthcare system being what it is in the United States, that seek primary care in the emergency department because they don't have another choice or another option. And so we do see we've seen a rapid decline in those types of patients coming in that are there for just kind of routine things, and people coming to the ER for, you know, actual emergencies.
Yeah, our hospital census is way low. They want to send people home, and we just don't have the patience to keep up the numbers for work. But I'm scared to send people home because we don't know what's going to roll through the door any second. So it's, do I or do I not?
Wow.
So.
But we want to thank both of you guys for joining us. My cat just showed up in the
Our dogs have been walking around like, what are you doing?
We want to thank you both for joining us, but it's very clear. And if is there anything that you want the folks at home to know, or folks watching this to know about what they can do around COVID-19 or what you guys are experiencing? Because I think people are talking to the folks on the front line, but once again, they're not talking to respiratory therapists. They're talking to some nurses, but not all nurses. If there's anything you want folks at home to know in this conversation, because the whole idea of this is for us to sort of talk together and build community.
I think the biggest thing that we need to drive home is that everyone needs to stay home.
Yeah,
and to practice social distancing. Slowing down the spread of this is the only thing that we have right now to combat this. If we overwhelm the hospitals, patients that have heart attacks and strokes and, you know, routine infections, you know, they're going to be in trouble because they're not going to be able to get to the care they need because we're overwhelmed with the COVID-19 patients. So staying home and really listening to science and reasoning, and not so much the kind of the notions and hunches that are being put out there by some folks that are in charge. We really need to listen to the experts right now, because, you know, healthcare professionals really only have one mission, and that is to care for folks and to advocate for everyone's wellness. We don't have another agenda. And so I would just ask that everyone listen to the healthcare professionals during this.
Yeah, stay home.
Oh, Lori, you have anything to add to that?
I just said stay home.
Yes, listen, America, if you can stay home, watch videos like this and get informed. We want to once again thank Lori and Rick Lucas from Ohio for joining us. And let's be very clear here. We are a community. No matter what they tell us, no matter what the colors and stripes are, we are one community. And COVID-19, whether for good or for bad, has shown us that. So I want to thank both Rick and Lori for joining us. And I want to thank you at home for watching as we continue to have conversations together.